Craving your next action-packed adventure? Audible delivers thrills of every kind on your command, like Project Hail Mary by Andy Weir, where a lone astronaut must save humanity from extinction, narrated with stunning intensity by Ray Porter. From electrifying suspense and daring quest to spine-tingling horror and romance in far-off realms, unleash your adventurous side with gripping titles that'll keep you guessing. Discover exclusive Audible originals, hotly anticipated new releases, and must-listen bestsellers that hook you from the first minute. Because Audible knows there's no greater thrill than the one that speaks to you. Discover what lies beyond the edge of your seat. Start your free 30-day trial at audible.com/WonderyUS. That's audible.com/WonderyUS.
The average researcher spends about 75% of their time raising money for research, and I feel like that's a waste of their time. And I'd rather them be in the lab doing more work or hiring more postdocs to bring in to do more experiments.
From Offscript Media, I am Matthew Zachary, and this is Out of Patience. On the show today, Dave Bjork, self-proclaimed, air quotes, research evangelist, young adult lung cancer survivor, and champion of the cause of direct-to-research philanthropy. What does that mean? Well, here's what I think it means. It's almost too easy to donate and support cancer research, but it's often this giant cauldron into which you throw your money and never know where it winds up. Cue the black and white infomercial, "There's gotta be a better way." How can I know where my research funding goes? Can I just avoid a middleman and donate to one specific doctor for a more immediate and tangible impact? I also learned that the actual process of research funding is insanely stupid and ridiculously antiquated. You shouldn't have to wait 20 years to get an NCI-funded grant. Anyone who's written a grant with a glass of Merlot knows exactly what I'm talking about. Also, does the life science sector have a bad rap? All this and more, my friends, on today's exciting episode. Enjoy the show. All right, Dave Bjork, self-proclaimed research evangelist. I have one question for you. How much shit did you get as a kid for your last name being Bjork?
Well, I'll tell you, Matt, I grew up in Minnesota, so Bjork was not that uncommon of a name. But once I went out east to go to college in Pennsylvania, it was over.
Did you do the whole weird European Swedish emo thing on purpose, or was that just by default?
Well, no, what my friends at Penn used to do to me is they say, "Dave, say Minnesota." I say, "Oh, you mean like Minnesota?" Like that. And I was like the hit of the party.
And when Fargo came out, tell me all about that mystery. I'm totally kidding. You don't have to tell me about Fargo. But
well, I love the movie because that's like that the woman Marge. That's my Aunt Barb, like for 100%.
For real?
No, she sounds just like her.
Well, I mean, I went to upstate New York. I went to Binghamton, and it was the first time I heard a flat A ever growing up in New York City, like Matthew. So I'm like, oh, that must be what it's like everywhere else in the country. So yeah. I respect all of your weirdness in being from Minnesota, eh? See, I can do it.
Yeah, don't you know, down there, hey.
I can't pull it off. You won the internet just with that with there. Anyway, let's get actually to why we're on the show. I was introduced to you through our dear friend Alicia Staley, so props to Alicia Staley. And you are a self-proclaimed research evangelist. I will opine that I am a cookie dough evangelist. So help me understand what separates the two of us.
Well, as a lung cancer survivor, I started to learn a lot about research. I was working a few years ago raising money for research, and a friend of mine, he called me the research evangelist. He said, "You should start on Twitter and start writing in a blog, because the Greek meaning of the word evangelist is bringing the good news, and I seem to always bring the good news."
Except when you had to tell people you had lung cancer.
Yeah, that is true. That was not fun.
How old are you?
I was 35.
Yeah, the perfect age to get lung cancer, right?
Yeah, especially when you don't smoke, right? And you have 3 young kids and you're playing basketball every day, so you think you're in good shape.
Well, that's always my question to anyone with lung cancer is like, hey, how many people did you smoke? Like, are we done with that yet? Why do we still keep saying that?
You know, we're still not done with that. But you know what I used to say to people? I'd say, I would sometimes get defensive about it. I'd say, well, you know what? If your uncle has colorectal cancer, did you tell him, did you eat too much meat, red meat growing up? It's like the stigma still exists. It's still pretty terrible. And a lot of us in the lung cancer community feel really badly about it, and we hate it, and we wish it would go away.
Right. It's been a large narrative. I mean, I worked in young adult cancer for 15 years. We had lots of communities around lung cancer, and the young people felt ostracized. But at the same time, like, you're 27, 36, 42, 19 with lung cancer. You didn't smoke. What's wrong with you? But I equate this to like my friends in the type 1 diabetes community, where people say, oh, just eat better.
Yeah, right. Yeah, so you know all about this, because how old were you when you were diagnosed?
I was 21 in college with brain cancer. And no one said, think smarter. Doesn't work that way.
Yeah.
So, all right, let's go back to this. 35, family, young guy, lung cancer, out of the blue. Symptoms, what happened?
Out of the blue. I went fishing with a buddy of mine, one of my roommates up in Maine, at his cabin, and just had severe chills and came back and ended up with pneumonia. And so I went in, got the chest x-ray, like they do, and sent me home with my antibiotics, and, went away. And then 6 months later, I got pneumonia again. And, my primary care doc, God bless him, I really like him, but, he basically said the same thing. But a radiologist saw the chest x-ray and I contacted my doctor and said, you have the mass, the infection is in the same spot. And so you should have a CAT scan. And so there, sure enough, that's how they found it on the CAT scan.
So you're lucky that guy paid attention.
Yeah, and it also, because it's people like me, you're not being screened at age 35, for lung cancer, because you're not at risk for lung cancer. So that's one of the big challenges of lung cancer, really.
All right, so I like to talk about how advocates are there to help make shit suck less for the next them. What about that experience was excoriatingly just insane for you that you want to course correct for other people?
I think for me, this was a while back. So I think the course correct for me would be to try to find people, with the access of social media now, to find other people that may have gone through experience that was similar to yours, because otherwise it's a very lonely road, to try to get information, and you're working with your doctor, your emotions are going crazy, as you know, and you're just trying to keep your shit together. So I think that sort of finding other people that you can talk to, that are in a like place is really important.
Yeah, the late, great Ellen Stovall, one of my mentors from the National Coalition for Cancer Survivorship, was very famous for saying that quality of life is tantamount to quality of care. And what you're describing is the need to not feel alone, isolation, mental health. And you wish you had it. I wished I had it. It kind of exists now. Where does that factor into research evangelism?
Well, for me, research evangelism is I've been trying to find a place as an advocate in the lung cancer space. There's a lot of advocates out there who are fighting for their lives right now. They're stage 4, and they're advocating for their specific situation. I'm not fighting for my life right now. I'm thankfully living a life of gratitude because I'm not still fighting lung cancer. So I'm carving out my space as my advocacy is shouting from the mountaintops on the need to continue to support research, because there's so many good things happening in lung cancer research that I want to be the one that's shining a bright light on the people that are doing the research in lung cancer.
So what is your actual hill to die on in one sentence?
I would like to help academic researchers and biotech scientists get the proper funding so they can find new ideas. Because right now that's more than one sentence, is it? I'm sorry about that.
I forgive you. Go on.
Because the average researcher spends about 75% of their time raising money for research, like writing grants and going to fundraisers and whatnot. And I feel like that's a waste of their time. And I'd rather them be in the lab doing more work or hiring more postdocs to bring in to do more experiments. So that's what I really care a lot about. It's
like the government official who spends all their time raising money and they can't legislate.
Right? Exactly. I mean, that's a perfect example. If you're spending, like my friends that are in the research world, they're up 11 o'clock at night, midnight, they're still writing grants. It's like you never talk to them because they're not seeing their families because they're writing grants all the time. And so I'd rather them be doing the work that makes a difference.
So let's talk about that particular issue. It's like cholesterol in the artery. To actually get funding to do something, it takes you longer to do this. It's like I'm going to throw in a cigarette red. It's like the cigarette is like 90% filter and 1% tar, right? It takes you all that time just to get to the tar. Why is that the way it is? Is it built by design to be stupid, or is it just become the way it is because that's the way it has to be?
I think it's been designed that way. I think the whole process of getting, government funding. If you want to get an NIH grant, well, good luck, because the average age is about 43 years old now that a researcher gets their first big NIH grant. So, and in ecology, you probably know that the chance of getting funded is like 10 or 13%. So the system is set up that way. And then I think in philanthropy, what really bugs me is that, people might give, $20 million to Dana-Farber or to the American Cancer Society or whatever, but how much of that money is going to research? The people in the research labs at Charlestown at Mass General Hospital, they're not seeing that money. So why do we think that way? Why don't philanthropists think that they can fund an individual lab? Much more efficient, right?
Well, we talked about this on our call, just for the listeners. Dave and I had a call a couple of weeks ago and kind of got on the same page about most of it. We agree on pretty much everything. And you're right. We talked about the horse blinder effect of people that want to make a difference and give back. And the shiny objects are always the big box groups and the big name groups and the corporate brand groups. What would make someone think to pause in the window between, I've got money, I want to help, what do I do? And make them understand or appreciate the objectivity of where they can perhaps create a portfolio of philanthropy instead.
Right. I mean, there were a lot of good researchers out there, that need funding. There's a lot of famous ones that are doing just fine, but, you're 38-year-old or 40-year-old researcher slugging away trying to do your thing. People could fund individual labs. You can fund multiple labs if you wanted to. You could find a portfolio of a lab in California and a lab in Massachusetts and one in Texas. And you know what I mean? You literally could actually build a portfolio that way.
So you mentioned that no one really gets their money from the NCI until they're 43 years. What are they doing for 20 years leading up to that moment? Writing grants?
They're writing grants. They're probably getting a lot of smaller grants. They're writing to like the American Lung Association, to other foundations, 50,000 here, 100,000 there. It's like one of my friends, John Wettstein, who's at Mass General, now he's at Fox Chase, he described it as really running your own business. It's like making hiring decisions, making purchase decisions on equipment, and it's like based upon funding. So if you get a grant and it's a 1-year grant, then you're like, oh, I got to chase down $100,000 again next year. So it's just a constant battle.
It's like there should be a stock market exchange where people can invest in researchers and kind of like not like The Bachelor or The Bachelorette, but is there anything like that? Incubators, accelerators that have risk models on what's best to invest in, which researchers can do X, Y, and Z?
I've actually heard of one recently. It's called Benefunder. A friend of mine out in California is doing some work with them, and they're trying to match. They have a sort of a stable of researchers, and they're trying to match them with wealthy, high net worth individuals and family offices. And so I've actually been talking with them about how I might be able to collaborate with them. I think that's kind of a cool idea.
It really does sound like, I don't feel like we're inventing the idea here on the air, but at the same time, you're right. We need to create better equity, parity, but also KPIs, jargon for key performance indicators, listeners, on what we're holding researchers to do. But at the same time, science is designed to fail and learn. So how do you conflate success with failure and ideation? Anyway, I'm jargoning, but what are your thoughts on that?
Well, that is a tough question, because science is designed to fail. And so often that's another, talk about paperwork, that's another big part of the process of reapplying for a grant is like, so what success did you have? And that can be part of the equation to get the next round of funding. So it seems to me that, there are times when there's research discoveries, or even if you did a project and it failed, that's still advancing science, because you at least have an answer, right?
Right. Mm-hmm.
So I mean, I don't have the answers either as far as like how do you grade that and how that all works, but it feels like there are definitely progress that gets made in a lot of these labs that it's just a lot of work for them to keep a project going.
I mean, my listeners know that my hill to die on is making sure people know shit exists. And what I mean by that is, and I've been saying this ad nauseum, is when you get sick and something bad happens in the cancer world, you enter a market that's kind of like supply only. No one demands to be there. And you're at the mercy of a system to make you aware of your choices. So all the research in the world, all the breakthroughs, all the new things that are happening that get brought up the chain of FDA approved, whatever it is, if you don't know about it, it's no good to you. Where are you in that equation?
It's an excellent point, Matt, because one of the things that really drives me is this equality of care, right? And so whether you're racially diverse or whether you're geographically diverse, if you're like, I'm from Minnesota, okay, so my Aunt Barb lives in northern Minnesota. So is she getting the same level of care that I got at Mass General Hospital, right? With all the precision medicine and stuff that's happening, it's like I don't know that that's the case. I think a lot of the biomarkers right now in lung cancer have been identified, but I don't know that all of the people are getting genomic tests across the board.
So, Dave, what you just described in Jargon Town are called social determinants of health, right? That just means like the shit that is meets the shit that might be creates the shit that will be. And can you make it any simpler? And yes, whether you're in rural America or at a name brand giant cancer institution, there are different systems in place to provide you with objective decisions and doctors who may be more aware of the 70,000 new FDA approvals that happened that week.
Right. Yeah, I think that's it. And it's not just to criticize the oncologists in a rural setting or a community setting. There's so much information, and isn't that really the problem? And how do we keep how fast things are changing? It's like people are talking about machine learning and AI and how that's going to supposedly help decision making, but they've been talking about that for several years. I'm not sure where that's at.
Yeah, it's an equation that has no number at the end of the equal sign, and everyone's trying to figure out a way to make sure that there is a number there. But in terms of what have you discovered? So someone branded you the research evangelist. Where has that taken you? Now that you mentioned before that thankfully you're not in the muck, in the sty, in the mire of dealing with cancer, and you're here to make things suck less for other people. Where has that journey taken you in the past couple of years? Well,
the journey has taken me to, working as a vice president of, my friend calls it the vice president of spreadsheets, the vice president of development at the National Foundation for Cancer Research, where, it really was, I call it making the donuts, but it's like hit people up for money all the time and this and that. And good mission, supporting, seed funding for, early academic research. But if you're raising, several $1 million and only a fraction of that's going to research, I find that to be very inefficient. And so where that's leading me to is, to take my research evangelism and start becoming more vocal, even more vocal. I've been writing in a blog for many years, but I'd like to be, part of, the conversation on a podcast and talking about, the need for funding, because there's great people out there doing great work, but funding is a problem. And so I feel like the evangelism is going to be, if you really care about research, then I would not, no offense, but I wouldn't give money to the American Cancer Society, because that's not going to go to John Wettstein's lab at Fox Chase, or a very small fraction of the millions and millions of dollars. So that's where the evangelist is going, bringing the good news, right? So how do I shine a light on brilliant people who are not famous, but maybe they should be famous?
Back with our guest after the break. You wrote a piece on, I think it was LinkedIn, shining a light on the good people in the life science community. So let's pivot from the problem to are there solutions? Because I want you to answer the question. The life science, that's like a big quote, like you people, the life science sector. Does it have a bad rap? Is it woke to what you are trying to espouse the virtues of? And are there really just bad actors that won't listen?
I would say a good point about life science. It is kind of a big catch-all phrase, right? So I believe that there are, really good people working. And to me, life sciences is academic research labs, it's biotech companies, it's the investors that help that process, it's the organizations that amplify the work. But they do have a bad rap. Biotech and pharma has a bad rap. Now, yes, some of it might be, I'm not here to debate that whole thing. That's a whole different argument. But I see it from a perspective of a patient, and a lot of the people I know, hundreds and hundreds and hundreds of people who work in the space. And yes, there might be a few bad actors, and those make the headlines. But most of the people have a story to tell. You know, they lost their son to epilepsy, or they grew up in a hardscrabble environment and just always wanted to be a scientist. So there's a lot of people within this space that I think are doing good work for the right reasons with their heart in it and go to work every day thinking about those catchphrases like, finding treatments for patients with unmet medical needs, right? That's a buzzword. I'm not saying everybody believes that, but I run into so many of them. It's a common theme. And so again, I think people should know about that. And then we can debate pricing of cancer drugs and all of that. We can all debate that, but let's don't cast aspersions on all the people, the thousands of people who are working there, who you can't paint them with a broad brush and say, well, they're all just out for the money. And I hear that all the time. It's like, oh, they're just greedy. They don't want to find a cure for cancer because they can't make money again. I'm like, I don't know if that's true. I really don't believe that. But I know a lot of people do believe that. I mean, have you heard that, right?
Well, it's like the cure in a safe conspiracy theory. Yeah. And, if there was a cure in a safe, no pharma CEO's kid would have leukemia. And there are tons of pharma executives' kids who had leukemia. So
exactly.
It's like, I think the greatest conspiracy is just that there isn't one. And shut the fuck up. And there, I said it. All right. So All right. So this may be something that doesn't need to be explained, but I just want to do it for explainer's sake. Why? And I'll get into part 2. Why is it beneficial to give to an individual researcher than a big box group? Because it isn't as much as where does the money go, but how is the money spent?
Yeah, I think the process, in my experience, now I've worked in the nonprofit world, for many years. And so the process, no matter what organization, they all have a process. I'm using quotation fingers that you can't see. But the process means that they, the money comes in the door, and it kind of filters through, it pays the salaries and the lights and this and that. And then there's some process where the advisory board or someone says, now we're going to rank these different projects and we're going to pick what we think is the best one. And our donors are going to trust us that we're going to pick the right ones. And that seems to be pretty common. So the way that I see it is, if you care about leukemia, or if you care about a specific type of leukemia or lung cancer or something that's epigenetics or whatever, if there's something specific that affects your loved one, that you could find someone who's actually doing that work. Like, think of it in like a rare disease, like how cool it is when I see patients or families actually meet a researcher that's actually working on that specific thing that affects their family.
Yeah, that's crazy karma.
It is crazy karma. So it is maybe not so much, where the money goes, but it's like, how is it spent? So if you gave $100, you want $100 to go filter through that system. So, 25 cents goes to research and 25 cents goes to this and 18% goes to that. Because that's really what I see a lot. There's really, there's really few of the organizations that call themselves research foundations, where the 100% of the money, or even a high percent of it, is going to actual research.
So, Dave, I think it's important for our listeners to know that there's another side of you besides being the research evangelist, is that you're the co-founder of a group called Cannons Fighting Cancer and a group called Fraxa Biotech Games, which I read about. It's super amazingly cool. Can you talk to us about where those came from? And I assume they're just byproducts of your being an evangelist anyway.
Totally. Yeah, the idea for the Cannons Fighting Cancer was, and actually the common theme between the two is, I love to bring people together. It's one of my Simon Sinek whys. Is like, I believe good things happen when you bring good people together, and people who care. So the Cannons was, how do I get the lacrosse community of kids from 8 years old through college, and the professional lacrosse team in Boston called the Boston Cannons, to do something really cool under the spirit of unity. So we brought all these people together. We did a charity game at Harvard Stadium with a bunch of former players. And we raised money, and the story was we're going to raise money to go to Dan Haber's lab at Mass General Hospital. And we raised $125,000, and it was really awesome. It was really fun. So the biotech games was a play on that. How do I bring together another community? Let's bring together the biotech community of companies, many of them that you've never heard of. It's not Pfizer and AstraZeneca. It's a bunch of companies that no one's heard of, but there's so many of them. And they love to compete. There's a lot of younger people. Why don't we get together to network, have a good time, serendipity of like meeting fun people, and let's play some cornhole and can jam and bucketball and have a couple of beers and some burgers and see what happens. And we'll raise money for a good cause. And so the first year, well, actually over the 3 years, we've raised about $150,000 on that program. So again, it's bringing good people together, and I believe that good things happen when you do that.
Just really incredible paid for kind of stuff. Let me end with the happy ending story here is that you're still here. Look at that. My dad would say above the tulips, and your family's still well. I mean, I can imagine only what it's like for dad to get sick with kids and everything. So give us a story. What's life like for you in the insanity of COVID, but at the same time, how are we still here?
Yeah, you're still here too. Don't forget. I think you are, right?
One could argue, but I'm going to agree.
Yeah, well, I think for me, when I say being here, it's still because lung cancer many times is not a very good diagnosis. I'm still here 20 years later from when I was diagnosed, and so I live a life of gratitude. My wife is a nurse. My youngest son is also a nurse. They both took care of COVID patients on the front lines in March and April. And so we have a deep appreciation for people who are doing good work. So that's kind of my view of life. But I think like you, I'm ready to just shake things up a little bit more and kind of break some of the things that I think need to be changed. So how about you? What's it like for you during COVID?
I guess I'll conclude by saying that if a dumpster fire was inside another dumpster fire that was being thrown off a cliff into a river of lava while spiraling on a planet with no gravity into the center of a black hole. I think was that visual enough for you guys listening to the show? I hope so. Very short
Awesome.
answer to a short question. Oh my goodness. Dave Bjork, research evangelist, patient advocate, lung cancer survivor. You are a rock star. We got to get this narrative out to more people, funding the right research for the right purpose. Thank you so much for coming in Out of Patience.
Thank you so much for having me. I loved it.
That's all for today, folks. If you like the show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. Out of Patience with Matthew Zachary is a product of Offscript Media. Our executive producer is Matthew Zachary. Our senior producers are Jen Horangeff and Andrew McDowell. Darren Tunn is our production intern. It is recorded, mixed, and edited by Matthew Zachary. Our theme music is by the Mike Van Allen Quintet and by Mara. For advertising and media inquiries, email media@offscript.com. Hit us up at contact@offscript.com to share comments, feedback, and make guest recommendations. For more information, visit offscript.com.